So we're going to take a look at the brachial plexus here, and you want to see that we had to cut the veins out of the way here. So right here is at the end of brachiocephalic vein splitting into the jugulars, subclavian. Here is subclavian going down towards axillary vein. So we cut those things so we can move them out of the way so they wouldn't be on top of this area here. Notice we can still see, here's that thyrocervical trunk and the couple of branches off of that. Here's your anterior scalene muscle coming there, right? So just so we can orient ourselves, and we can see subclavian artery going underneath anterior scalene coming down here. So we're going to kind of just, for the most part, hold the artery out of the way so we can expose this area right here. So we want to kind of correspond this to a drawing that we have of this area. So if we look up at the drawing, this is the same exact area here, and we were just looking in this area right here. That was what we had just uncovered here. So notice on the drawing that we have these dotted lines. This area of the brachial plexus is going to be where we'll call the nerves trunks. Down here we have cords. Down here we have nerves. So 3 different levels of the brachial plexus. So let's look over here and correspond those levels. So right about here would be where we have trunks. About here would be where we'd have cords. Down here, nerves. So again, here trunks, here cords, there nerves. So that kind of corresponds to the picture we have there. So let's find the trunks first. So we take this subclavian artery, we hold it down out of the way. And here you see we have 1, 2, 3 things here. And that would be your inferior trunk, middle trunk, superior trunk. Those 3 things. And that's going to correspond over here, inferior, middle, superior trunk. Now, once we find the trunks, if we move proximally, we should see the roots of the brachial plexus there, which we can see here. So we come back over. We find the trunks here again. We have those 3, 1, 2, 3, and we follow them up, and we can see, open this up a little bit. Here is C5 and C6 forming superior trunk. Here is C7 going right into the middle trunk, and then here we're actually going to flip this way, a little easier to see, and right there is going to be C8 and T1 joining to form the inferior trunk, right? So this would be cervical nerve 5 through 8, and then thoracic nerve 1 going down to the trunk. So now we come back to the drawing, we look at the trunks, and we go distally now, and we can see that each trunk splits into 2 things, and we have all these A's and P's on here. Those are the anterior and posterior divisions of the trunks. So we come back over here, and again we find the trunks, which we have there, and we're going to grab right here, and I'm going to kind of move this out a little bit, and I'm going to grab over here and move that out a little bit. So as I'm holding this out like this, and I'm actually going to let go of that side for a second, right here we can see pretty well that the superior trunk splits into an anterior posterior division, and then we come over here and I'll grab right there, and this is the middle trunk splitting into an anterior posterior division, and then we'll just move this over a little bit, and there is the inferior trunk splitting into an anterior and posterior division. All right, so again we hold this out like that, and we can see all of those anterior posterior divisions. And we come back over to the drawing, and we can see that the divisions rejoin to form cords here, right? So these 2 anterior divisions form lateral cord, all the posterior divisions form the posterior cord, and the anterior division of the inferior trunk forms the medial cord. So we want to see how that comes together. So we come back over here, and if we get the first 2 anterior divisions, so this one and that one, they join together right there. That's going to be the lateral cord. So that's the anterior division of the superior trunk, anterior division of the middle trunk, lateral cord. We come over here, and the anterior division of the inferior trunk here just becomes the medial cord. Those are the same things. Then if we kind of move this way, I think maybe hold it up like this. So if you look right down here, we should see all of the posterior cords coming together. So here's a posterior divisions coming together. So there's a posterior division, there's a posterior division, there's a posterior division, and they all join together right there to form posterior cord. Can you see that there?
Yeah.
Decently? Okay, that would be there. So that's one way to find the chords. Now, once we found it that way, we come back to the drawing and we go down to where we have the nerves down here. And we can see that if we follow the nerves proximally, that some of them will lead us up into the chords depending on where we go. So you want to note that all of the chords are named for their position around the axillary artery. So let's see that over here. So let's grab this, hold this up like this. Okay, so I'm holding the median nerve here. And if we follow the median nerve proximally, we can see it's formed by two branches here. One of those branches comes from the lateral cord, and one of the branches comes from the medial cord. So using the median nerve, following it up, we can lead us back into the medial and lateral cord. Now notice that those cords are passing around the axillary artery here on the lateral or the medial sides. So that's where the names of those cords come. Now once we have those, if we kind of move them out of the way like this, what you're left with behind the axillary artery here would be posterior cord. So holding up the median nerve leads us in the medial and lateral cord over here, and moving that out of the way, posterior cord behind. So another way to find the chords. Now back over to the drawing. Next thing we want to find are to be able to identify all these nerves. So we already found the median nerve, but now we're going to find all the other ones. So notice that we have this M shape here, and that's for the first, the third, and the fifth nerve here. The second and the fourth, they're located deeper. So what we end up having is three nerves like this, first, third, fifth, and then second and fourth deeper like that. So when you put them all together, you have five, but they're on two different levels. We're going to find this level first, then we'll move them out of the way, and then we'll find that level down there. All right. So again, we find the median nerve here, and hold this up like that, and if I kind of lay that down, think like that, trace this up, down, we have this M shape here. And that's going to be your musculocutaneous nerve here. It's going to be your median nerve in the middle there. And the one I'm holding on this side would be your ulnar nerve. So that makes up the M. Those are the ones that are more superficial. Once we find those, then we kind of move all that stuff back out of the way, and we go back down to that posterior cord down here, and we can see that that splits into two things here, and that is going to be your axillary nerve and your radial nerve, and those would be the two deeper ones. All right, so again, if we hold this up here, we have this M shape, which is musculocutaneous, median, ulnar, and then we come over to the drawing and we see right here, musculocutaneous, median, ulnar, makes up that M shape there, and then the other two, axillary and radial, would be down here, axillary here, radial there, off the posterior cord. All right, we want to follow some of those nerves further down. So we found our five. We had the three that made up the M shape, and we had the two that were a little deeper. We're going to trace them down. So let's uncover the upper extremity here. We'll uncover all the way down here. All right, let's bring the arm out a little bit like this. Okay, so let's start with the median. So we have median nerve here. We see that it goes right down the middle of the arm. We can see it diving deep right here because it's going to go underneath of pronator teres into the forearm. The next spot we're going to find is we're going to take flexor digitorum superficialis and we're going to turn it over, and we should see the nerve right here. There's the median nerve right on the underside of flexor digitorum superficialis, and then that nerve is going to end up emerging in the palm, and it's going to be this stuff that's coming up through here. So that was, again, what went through the carpal tunnel, was that median nerve. So you want to notice that it stays in the midline all the way down. Middle of the arm, middle of the forearm, middle of the hand, all the way down. So that's median. Come back up. Let's find musculocutaneous, which is this one here. And you can see that musculocutaneous is going to go down and go through coracobrachialis right here. So we're just going to spread apart biceps, coracobrachialis like that, and we can see musculocutaneous here. You can see it coming out again here. and it goes down towards biceps. Now on this particular body, you can see that musculocutaneous comes over here and joins back in with your median nerve, which it does not always do. Lots of times this does not come together. It will stay over here going towards biceps and brachialis and go down. This one happens to join back in. It's just a variation. For musculocutaneous, once we get below the elbow joint, it's going to be cutaneous the rest of the way down. So with most of the skin removed, most of those branches are